Welcome to the fifth episode of STEM Spark, a podcast dedicated to helping teenagers explore different careers in STEM. My name is Mira, and I am your host. As a high schooler who is currently struggling to determine my future career path, I created this podcast to hopefully explore some different career options while helping others do the same. I hope you guys are just excited for today's episode. It will be a great one. Today's guest is Dr. Asha Anandaiah. She specializes in pulmonary disease and critical care medicine at Beth Israel Hospital, and is also an assistant professor of medicine at Harvard Medical School. I'll now turn it over to Dr. Anandaiah herself to introduce herself further.
Great. Thanks, Mira. Thanks so much for having me. And that's correct. I'm an academic physician is kind of my general, let's say, occupation, which means that I practice medicine, but also am an academic, so participate in a lot of education and research. And that kind of trifecta of clinical practice, education, and research is kind of the kind of hallmarks of a career in academic medicine.
That's awesome. That's super cool. So I just want to start by asking, like, how did you get interested in like the field of medicine in general? And like, was it something that aligned with your interests when you were like younger? How did you get to your interest in this?
Yeah, it was a little bit full circle for me. So my father is a physician and was in some ways, in many ways, a role model in terms of having a career that seemed incredibly fulfilling. But on the other hand, I didn't necessarily grow up wanting to be a doctor.
Mm-hmm.
I was more interested in exploring a variety of ways to sort of use different kind of gain skills in order to have a positive impact. And I struggled a little bit with whether that positive impact should be primarily focused on individuals
Mm-hmm.
versus, larger populations or
Sure.
the world, so to speak. That was my kind of driving interest. And I
Mm-hmm.
thought about doing a lot of different things and didn't necessarily think in the beginning, even though medicine was the thing I was most exposed to, that was the path I was going to go down.
Mm-hmm.
But in sort of thinking about different careers that sort of achieve those goals of kind of having a positive impact, but also developing really concrete skills and a career that's also intellectually satisfying,
Mm-hmm.
it ultimately kind of, I came back around to realizing that medicine was, one of the really clear ways to combine those things.
Totally. That makes a lot of sense. Um, Following that, like, so in like high school, for example, was this already something that you've been thinking about, or was it kind of like is that when you were having these like questions about what you might be interested in?
Yeah, I think at that point I thought I was more interested in doing something kind of bigger picture.
Mm-hmm.
And so I was interested, academically in high school, I was definitely kind of interested in everything and sort of
Sure.
equally interested in kind of math and science, but also really interested in, things like literature and history. And so I kind of loved everything and thought that I would pursue something more ultimately, that would have impact perhaps
Mm-hmm.
through policy or, non-governmental organization type work. Those were the things I went to college thinking I might do. So again, kind
Mm-hmm.
of more that big picture impact than the individual impact.
Got it. So then when you like moved into college, what did you end up majoring in, and how was that like experience for you?
So yeah, I actually so I kind of changed my major a few
Mm-hmm.
times. I
Mm-hmm.
started out majoring in urban studies was what I
Got
thought I
it.
was going to major in. So again, trying to sort of understand the history and policies and things that impact urban life in the United States. So that was more
Mm-hmm.
focused domestically. And then I became more interested in expanding that scope, and I was going to do international studies. And I took a bunch of
Mm-hmm.
classes in urban studies, and then I started taking classes in international studies. But
Mm-hmm.
sort of partway through, I sort of, probably because of my father had in the back of my mind this, medicine was there as a possible way to achieve these goals or combine
Mm-hmm.
them with my goals. And so I was
Totally.
started taking the prerequisite classes for med school. And ultimately, when I decided I was probably going to go to med school, the major I ended up having was this sort of atypical Bachelor of Arts major in human biology that was combined, sort of used my biology credits along with some humanities credits. So it was this sort of kind of atypical major, but allowed me to sort of
Interesting.
put everything I was interested in and had already taken into a major. And at that point,
Totally.
I sort of knew I was going to go to med school at that point, that I was less interested in, you know, taking more and more classes focused on one area and more interested in using the rest of college to study all the different things that I wanted to study that weren't medicine.
Totally. That makes sense. Yeah. That's super interesting. So I feel like I've heard a lot of people who like they pick one major in college and that's like what they know they want to do. So it's almost interesting and to hear about how you were interested in multiple different things. I think that's something that like myself as of right now is like struggling with a little bit because it's like hard to know exactly what I might want to pursue. Um, but yeah. So you mentioned in college you took a lot of different classes that align both with and with like not with um, kind of med school, like the typical way of pursuing that. Did you take the extra classes just kind of in order you said to fulfill your interest in these other fields, um, or was that like also meant to align with the med school?
I think I was still struggling with that.
Mm-hmm.
Medicine is a way to definitely have positive impact. You can do a lot of great things and help people. And urban studies and international studies were potential avenues to do some of kind of have that broader impact and
Sure.
perhaps, work on things that could affect policy or work in non-governmental organizations to have
Mm-hmm.
impact, maybe on a local level in different places, whether that be in cities or in other countries, developing countries. And I think, um, medicine was always there as something I had a familiarity with.
Mm-hmm.
And I think I realized and sort of learned from other people that, and this is sort of ties into my current career, that particularly if you're in academic medicine, there are ways to combine those two things in medicine. And I think that's a somewhat unique thing, that there are
Mm-hmm.
paths, in medicine that allow you to practice medicine, but also like do so many different other things.
Totally.
You weren't
Yeah.
closing any doors. And I think I was always like what it sounds like maybe you are, like interested in a lot of different things.
Mm-hmm.
And to be honest, I think a lot of my path is sort of like the thread is not wanting to close doors and wanting to kind of keep, do lots of different things.
Mm-hmm.
And so medicine sort of allowed me, I realized that I could do all of the above. Potentially, I wasn't closing any doors.
Totally.
So that's sort of how it all came together.
Yeah, that makes a lot of sense. That's super like almost reassuring to hear because like I think it's often a like fear of mine or other people I know that like you have to pick one thing and that has to be what you're doing and there's no like option for trying new things and stuff. So it's something that it seems like you were definitely able to do.
Yeah, I think, there are definitely some people who find a passion early, and really like fall in love with something and then pursue it somewhat
Hmm.
single-mindedly and passionately. And I think part of me has always been envious of those people because they don't sort of struggle with all the different things they could do or want to do.
Hmm.
But I think there's like, it's different for everyone. If that happens to you, that's great. But I
Right.
think there's positive aspects to being interested in lots of different things and to be a person who could probably be happy doing lots of different things and spending a lot of time exploring is, as early as you are, is a great thing.
Hmm. Yeah. Yeah. Um so yeah, once you decided that you were going to go to med school, was there any like changes in your college experience or was it kind of like just continued with what you had been doing?
Yeah, no, I think the biggest thing was I decided to sort of switch my major to this
Mhm, right,
kind
that
of
makes
a
sense.
little bit of a mesh major. It just allowed me to put everything I had studied into a major. It fulfilled the
Mhm,
requirements because then I knew, I just wanted to take the classes and learn whatever I wanted to learn about.
yeah,
Because if I
that
was
makes
going to
sense.
go to med school, that was kind of going to be my major in life, and so that was the biggest thing.
Mhm, mhm. Yeah, so then following college, you went to med school.
Mhm.
Yes, how is that for you? How was that transition and how was that experience?
Yeah, med school was definitely a step up in terms of academic. I went to a pretty academic college, but med school is pretty intense in terms of it's a relatively small class of people, and everyone's kind of, at least at the time, everyone's taking all these core classes all together.
Totally.
It's pretty academically intense. So it was just a different environment that way.
Mhm,
But it was also really interesting, and it was reassuring to know that, I think when you're really challenged and in a really intense experience, you figure out pretty quick if it's something you like or not. And so I was reassured that I really enjoy learning those core things about medicine, like anatomy and physiology in particular, really was super interesting and fascinating to me. And I think those early parts of med school where you learn a lot of fundamental physiology kind of in retrospect, really shaped the career choices I made in the future.
Got it. Got it. Yeah. I'm not like super familiar with like what med school's like format is. So like what was your kind of day-to-day experience like while you were there?
Yeah, med school has changed a lot, I should say. But traditionally, the first 2 years of medical school are very classroom based. That has shortened in a lot of med schools. So now
Got
a
it.
lot of med schools, it's 1 year or a year and a half. But
Mm,
traditionally, the first 2 years was sort of, again, it was like the whole class in a room in the mornings, usually, and your lectures, very didactic. And then the afternoons were smaller groups, like problem based learning. But all, in my med school, it was, the first 6 weeks were it was anatomy, and you just studied anatomy intensely, with lectures and then dissections and small group learning. And it was sort of these very full kind of 8 to 5 days almost of, which is very different than college, right? And then in the third year is your year that you go into the hospital and you do all your clinical rotations. So all the
hmm
main kind of fields of medicine that you think of, like pediatrics or obstetrics and gynecology or internal medicine or surgery, all that, you sort of do all those rotations and get exposed to the different fields. And then you kind of refine what you want to take electives in to help you decide exactly what you're going to apply for residency in.
Yeah, that makes a lot of sense. Um, yeah, that's super interesting. So, following med school, you applied for residency? Question mark.
Yep, exactly.
hmm And
Yeah.
yeah, how was that experience? What was that experience like? And like the applications and stuff too.
Yeah. So kind of towards, it's like the, last year, early part of the last year of med school, you decide and apply for residency. And, like all application processes, that's, could be kind of an intense time as well, because you feel like you're making this big commitment. And, one of the big things about a career in medicine is there's so many, the training is so long. So you've
Right.
applied and gone through college, you've applied and gone through med school, and then you're applying to go through residency. And for many
Yes.
people, including me, you apply and go through a fellowship after that. So, but it's an exciting time because
Mhm.
you're becoming a doctor, even though you still have a lot of training ahead of you, graduating med school and starting your residency. You're pursuing your path that's a little more individual, and
Mhm.
you're actually entirely in the hospital and practicing. And so
Mhm.
going around and looking at it's all, looking at hospitals and meeting practicing clinicians, is it's exciting. It's kind of the
That's
transition
super
to the real
exciting.
world.
Yeah, yeah. And then like in residency, does that just kind of look like you're practicing almost? I don't know.
Yeah, so in residency, so I did internal medicine, which is pretty,
Mhm.
broad residency, and most of it, especially at the time, was hospital based, and so you were in teams. So this gets into sort of the academic structure where I currently practice as an attending, and it's sort of team based, and there's different levels of learners. So sometimes there's medical students, there's always interns and residents, which are the different levels of
Mhm.
residency, and then often fellows as well who are training in the specific subspecialty, and an attending who's supervising. And so you're practicing medicine, you're seeing patients, but in this way where the responsibility is graduated among those that are sort of on the ground doing like the
Interesting.
work, and spending the most time with patients, to the more supervising who are
Interesting.
teaching and guiding the more junior trainees.
Got it. Got it. That makes sense. Yeah. And then you mentioned that you did a fellowship after this as well. This seems like the process was very long.
Yes, that is one of the things about a medical career. You can stop after residency, so that's kind of the
Mm,
minimum, is you have to do a residency. So if you want to do a more primary care type of specialty like internal medicine or pediatrics,
yeah.
or others, you can do a residency. But if you want to subspecialize, you do a fellowship, but it's not required. And
Got
that
it.
was in pulmonary, as you mentioned,
Mhm.
pulmonary and critical care medicine.
Interesting. Interesting. Yeah, I mean, that's super cool. I've always like I guess I've never kind of seen the path to becoming a doctor like actually laid out like that. So that's like super interesting for me to like learn about it. So yeah, like following your fellowship, where did you go from there? Like how did you decide, like was there any like decisions and what was the next step or choices that had to be made? Um
Yeah, I think one of the big things as you're moving towards practice is really like, what kind of a practice do you want to do?
mm,
And one of the big kind of dividing points is more like what we call going into the community, or like practicing in the community, having a private practice or working for a practice, where you're really taking care of patients, using your training and caring for patients, versus academics, which, as I mentioned before, you're in a university based situation and you have a faculty appointment and you teach trainees like I described. And then most often, you were doing some sort of research. And so there's a lot of different nuances to what an academic career can look like, but that's the general kind of scope. And so, and there's a lot of practical differences to what those two lives are like. But for me, I think I was always very knew that I wanted to stay in academics because getting back to the variety, like I like doing a lot of different
Totally.
things. And so it allows you, and that's where the opportunities, I have colleagues who practice in critical care medicine like I do, maybe 25% of their time, but then spend the rest of their time actually doing health services research to have studies that impact policy. So you can do that in medicine, or you can be primarily clinical even in academics and do 80% clinical, but with teaching as a big part of it. So there's lots of ways to spend your time in academic medicine. And so that kind of fundamental thing of wanting to do lots of different things and is kind of what drove that for me. And I think also the intellectual satisfaction. I think being in a teaching and learning environment kind of keeps you on your toes and you're always learning new things, which is always something that I have enjoyed.
Yeah. Yeah, I wasn't really familiar with like the different breakdowns that you've been mentioning. So that seems super interesting because I think I often like when I hear about roles as physicians or doctors, my mom, I just picture like clinical, like the doctor that I would go see if I went to the doctor.
Exactly. That's a
So
public thing. Yeah.
yeah, so it's really interesting to learn all about like this like the background and things like that. Um, so yeah, like as a doctor, I guess working in like this more academic setting, like, what does a day look like for you, and how does this like play out throughout your life when you're practicing and teaching?
Yeah, it's really it varies. So and it's different in every field and in every
Mhm.
job in academics. But my personal position, I do a mix of things. So one of the main hats that I wear at work is that I direct our fellowship training program. So we have
Uh-huh.
a fellowship training program in pulmonary and critical care medicine, and I'm the program director. So that's actually about 40% of my time is running this educational training program and being in charge of our trainees. And then I practice clinically alongside, those fellows, but also residents and interns and sometimes students. And that's primarily in the ICU, so the intensive care unit. And
Mhm.
that's a clinical practice where you do it for a week at a time or 2 weeks at a time. It's not something anybody really does all the time.
Sure.
It's a pretty intense clinical space to work in.
Mhm.
So I do that, probably like, 8 or 10 weeks a year. So just interspersed throughout the year, I'll be
Uh-huh.
in the ICU, and that's what I'm doing really full time in those weeks. And then
Yeah.
I do some pulmonary medicine, some similar weeks where I see inpatients, patients that are
Mhm.
admitted to the hospital with pulmonary diseases. And then I do clinic once a week where I'm supervising pulmonary fellows. So everything I do that is patient facing involves
Mhm.
trainees. Um,
Interesting.
and I love to teach. And then I also have this bigger hat running a training program.
Got it. Yeah, that's super interesting. I mean, like you said and mentioned a few times, like that seems like it's able to encompass a lot of different elements as well.
Yeah,
Yeah.
absolutely.
Just backtracking a little bit because I realized I didn't ask this. How did you decide that you wanted to go into pulmonary medicine and like critical care medicine? Like, how did you just decide that this is what you wanted to specialize in?
Yeah, I thought about a lot of different things going back to med school. I thought about obstetrics and gynecology because I was interested in women's health, and I ultimately chose medicine and then chose pulmonary and critical care because, and this goes back to again the personality quality of wanting to not close doors and do lots of
Mhm.
things. So critical care medicine is a specialty that is not defined by a single organ system, so you still
Mhm.
take care of the whole patient. So it's just to clarify, it's patients who are in the intensive care unit, which means that they have a life-threatening illness. So the
Okay.
specialty is really acute care in patients who are the sickest patients in the hospital. And so it's not just about, I'm a liver specialist or a lung
Sure.
specialist.
Sure.
Now, it can be, and in the case of my training, dual specialty with pulmonary medicine. So you get sort of you remain a generalist of sorts. You take care of the
Mhm.
whole patient and all the organs in the ICU, but then you also are trained in one organ, which is the lungs. And so again, that gives you lots of options. So at
Totally.
certain parts
Totally.
of your life, you may want to do more outpatient work and see patients in clinic with lung
Mhm.
disease. And there are other, you may choose to, at other times want to do more inpatient and do lots of ICU. It's pretty common for people to want to do lots of ICU when they're younger and then get a little bit tired. And then,
Mhm.
so there's lots of options there, and you can be a
Yeah,
specialist and a little bit of a generalist. So that's why I chose it. And then I think just the critical care was something that I think fell in love with. That's kind of what usually draws people into the field, is just the intensity of the medicine and the
definitely.
significance of that work is really fulfilling for patients, working with
I
patients and
bet.
families in those
Yeah.
circumstances.
Yeah. That's super interesting. Yeah. Yeah, I mean, I wasn't really familiar with like the specific um, kind of sub fields that you've been mentioning, so it's really interesting for me to hear about that. Um, like, what is one of the most difficult parts about your job?
Um, that's interesting. There's sort of different parts of my job, but
Yeah, but I would
probably
say, yeah,
the
more
most
broadly.
kind of obvious one is, I think, in probably anyone who practices in critical care, where, particularly in academic centers, I would say the, probably 30% or so of our patients don't survive.
Hmm.
And so I think there is, for obvious reasons, that's difficult.
I bet. Yeah. I
And then
bet.
I think also, as I mentioned, you're in charge of a whole team. ICU medicine is very team based. So in addition to the physician trainees,
Hmm.
there's nurses and pharmacists, and there's a whole, and you're sort of in charge of a team. And it's hard on everyone personally when
For
there's
sure.
difficult cases, but then also you're kind of trying to support and guide a team through those
Hmm.
challenges. So
Yeah. 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 That makes a lot of sense for sure. Um, like on the flip side, what is one of your favorite parts about your job? Like, what do you enjoy the most about it?
yeah. I mean, I would say twofold. One gets back to the exact same thing I just said was really hard, which is, I
Yeah.
think it's also the flip side of that is it's really fulfilling when people do well. And it's also sometimes really fulfilling even when they don't, to help the
Hmm.
family go through that, such an
I
intense
bet. Yeah.
process. And then the other thing for me, because, I'm an educator, that's sort of one of the biggest parts of my job as a whole. And I think it's incredibly gratifying, not only, the way all teaching is gratifying, but to really guide individual fellows in this really critical part of their career. Because, as we talked about, there are so many steps to training in
Hmm.
medicine. I mean, there, college, med school, residency, fellowship, but fellowship is the end. And it's really
Hmm.
when people differentiate into who they're going to be
I got it. Yeah.
the
Hmm.
last thing, and to really help fellows kind of figure that out and help them
Sure.
develop and really launch into their career is really
Hmm.
gratifying.
Yeah. No, that seems super cool. Yeah. Yeah. Um, yeah. I mean, I think this is so interesting. Like you're saying how what both the thing that can be really difficult is also like something that's very gratifying. So I think, especially in medicine, like I see that playing out for sure. And the last thing that I wanted to ask is just if you have any advice, just generally or more specifically for people like me who are like, I'm in my sophomore year of high school, right? So I'm like thinking of starting to think about college, and what I might want to pursue, but also like it's a little bit scary because it feels like I'm kind of determining what a lot of my like the rest of my life is going to be like. So I was just wondering if you had any advice.
Yeah, I mean, I think a few things. I think doing what you're doing is really valuable. I wish I had explored more, because I think it's really hard. Like kind of the premise of this podcast, it's hard to really understand and get insight into lots of different types of careers. So talking to lots of people early is really smart. I don't think that many people do it, but I think it's going to give you probably so much insight into different paths.
Yeah.
And I think so. I think exploring early. I also think knowing that a lot of careers are winding roads. Even I know so many people who someone who is thinking about STEM more broadly. I sort of skipped over the part where I spent about 5 years doing basic translational science in a lab.
Oh.
And I was interested in TB. That was the intersection with pulmonary medicine, and it
Okay.
goes
Yeah.
back to my
Hmm.
international. So I had more of a meandering path where that really included a love of science, and really making that the biggest thing that I did for about 5 years. And then I pivoted more to this education stuff
Hmm.
and ended up in this training program role that kind of combines it all. But outside of medicine, even I have colleagues who, friends who, were physics major and then ended up getting into more into computer science and, data science and AI. And, I think there's lots of paths, and I think it's great to explore early, but to also know that your career can pivot and to be
Definitely.
open to that.
Definitely. Yeah. That's super reassuring, I think, and also just like very insightful because I think there's a lot of pressure right now to feel like that you have to have that decision made. So it's like really interesting and like important, I think, to hear that that's not like necessarily the case. But yeah, I think that's pretty much it. Thank you so much for doing this with me. You've been super interesting to like listen to and hear your story. So I really appreciate it.
Well, thanks for having me.
Thank you so much for listening to this episode of STEM Spark. I hope you enjoyed listening to Dr. Anandaiah's story and learned from the experiences that she shared. Be on the lookout for STEM Spark's next episode coming shortly.